Welcome to Cardiovascular Matters. Whether you are looking for answers for yourself or someone you love, we are here to give you the best information available. Each week, the founder of Cardiovascular Institute of the South, Dr. Craig Walker, and medical device sales veteran Terry Roberts discuss the causes, symptoms, treatment, and prevention of health-related issues stemming from cardiovascular disease. Now here's your hosts, Dr. Craig Walker and Terry Roberts.
All right, welcome back to Cardiovascular Matters. You know, the premise of this podcast was to give patients and loved ones more time with the physician. And we're so lucky to have Dr. Craig Walker, who's one of the world's greatest cardiologists, and he's also a great friend of mine. But he has been in practice for 40 years, and I've watched his practice evolve. And, what we're going to be touching on today is obesity. And, he treats the entire patient. If they come in with cardiovascular problems, he gets back to the root cause of what may be causing some of these issues. And one of the biggest things he has faced with his patient population is obesity. And I think you're going to enjoy these next few segments we have because it's such a big thing. And there's great medications available now. And, the hurdles to get this stuff treated are no longer so great. It's not like you're looking at a big surgery or something that's irreversible or risky. I mean, this stuff is safe. So stay tuned. Take a listen to these next few segments, and we hope you get something out of it. Okay, we're back, and this week we're going to be talking about the medications that have been out now, I guess for maybe a year or two, but they're really becoming popular in terms of weight loss, and there's also the appropriate diet and things that you should do. Dr. Walker?
Sure. Well, Terry, the medicines that have, I think, revolutionized weight loss are actually diabetic medicines, but they're being used more in non-diabetics than in diabetics. But they're incredibly effective diabetic medicines, and many societies are suggesting that diabetics should be started on these medicines as first-line therapy. Now, up front, they're more expensive than the other diabetic medications, and most of them are injectable, but not all. And, but they are more expensive at this time. However, they've truly revolutionized this because they take away a lot of the hunger element, and when coupled with an appropriate effort at dieting, the results have been remarkable. In fact, I've had bariatric surgeons, people who've made their whole living doing weight loss surgery, tell me that this will put them out of business because they've started using it. They said the results were at least as impressive as their weight loss surgery, but without the side effects. So to start with, perhaps the medicines that we have the greatest amount of data with weight loss are a group of medicines that we call glucagon-like peptide agonists. And we call these GLP-1 agonists. That's the initials for them. And these represent a group of drugs that are incretin mimetics. Incretins are proteins that we create ourselves. And these have been used to target diabetes. Now, these are the medicines that we speak of. One is called Victoza or liraglutide, and it's taken subcutaneously, or it's injected routinely. Now, again, when I say injections, people think, that really hurts. Not so. These are microneedles, and they don't hurt at all. Another was Biduron or exenatide, and it's taken once a week. It's made by AstraZeneca, again, given subcutaneously. Another that we've all heard of on TV is Trulicity, dulaglutide, and that's taken once a week subcutaneously. That was made by Lilly. But the ones that have really gained the greatest popularity are semaglutide, which is Ozempic when it's used for treating diabetes, or Wegovy, it's the same exact drug for weight loss. This is taken once weekly, and that's made by Novo Nordisk. There's Ribelsis, which is once again semaglutide, and that is taken orally, and that's taken once a day. That's made by Novo Nordisk. And then finally, there is tirzepatide. And the name of that, when we're using it for treating diabetes, is Mounjaro. When we're treating obesity, and this is approved
Right.
for that, is tirzepatide.
That's
Excuse me, is
yeah.
Zepbound. Yeah, its other name is Zepbound. And again, that's made
That's
by
actually
Lilly.
what
Now,
I'm taking, Dr. Walker, is
that's the one.
tirzepatide.
And
Yeah.
both of these are excellent. And they both affect weight loss. There's more documented in terms of decreasing likelihood of heart attacks and heart failure right now with semaglutide, which is the Ozempic.
Hmm.
However, we just haven't had all of the studies. These drugs do differ a little bit in that tirzepatide has two effects. It also has a gastric inhibitory polypeptide, and that has certain effects. But historically, when we tried to lose weight, as cavemen, we wanted to hold on to that fat. Fat served a purpose. It when we didn't get daily things to eat, it gave us the energy and the nutrients that our body needed to live. But in America, we don't have a lot of
No.
starvation right now, and it's really serving as things which hurt us. So, how do these drugs work? Well, the GLP-1 agonists act like hormones that the body normally makes in the intestine to signal the pancreas that it needs to create more insulin. That's the first thing. And that allows us to process carbs and sugars taken orally. This helps the pancreas produce more insulin. It reduces the amount of something that we call glucagon in our body. That is very important. It slows stomach
Hmm.
emptying. That helps us to feel full with this and to not have the hunger cravings. It smooths out the spikes of glucose. Historically, if we looked at diabetes that we were treating with insulin or other things, blood sugar goes high and then it
Right.
comes low at times. This brings it right near the normal range, much more so. It smooths out those curves and it blocks hunger and it lessens the amount of food that we end up taking in. And all of those things help us to lose weight. Now, to be fair, there's some data that suggests maybe it also signals our fat cells to give up that fat a little bit more easily. As adults, we don't make more fat cells. We simply keep increasing the size of our fat cells. And they try to hold on to that fat at all costs, hence our hunger, hence how we feel when we try to eat. But this is important. So when we look at the effects that were shown with GLP-1 agonists as a group, we saw much better blood sugar levels in the morning and the afternoon, better blood sugar levels after meals. So we were not getting this
Hmm.
yo-yoing effect that typically occurs when treating diabetes. Substantial weight loss. These were not drugs created for weight loss. They were drugs created to treat diabetes. However, weight loss was shown to be important. And more recently, with semaglutide, there have been very positive cardiovascular effects. This has decreased death rate from heart disease. So as I mentioned before, this isn't just a problem of how one
Right.
looks. This is a life and death problem. And I this is really what got me into this field. Now, I've mentioned that there are side effects sometimes to these medicines. When starting the medicine, some feel indigestion or nausea. Occasionally, people at first may feel some diarrhea as the gut gets used to handling the slowed motility that occurs while taking this. But there are really pretty easy
Right.
measures to stop these things. To start with, eat smaller meals. You can eat more meals, but they should be smaller meals. And to be fair, your body will help you with that because you're not hungry and you fill up much more
Right.
quickly as you're eating. The second thing is to eat slower. Again, we're always in a rush and we tend to eat a lot and eat very quickly. We don't pay enough attention to how we eat and concentrating on the meal itself. And so this is very, very important. So if we look at the effects of this drug on the central nervous system or the brain, it increases satiety. We feel full quicker. It decreases food intake. There is slightly more nausea that occurs with this at first, but that typically is self-limited, and body weight drops fairly dramatically. At the level of the pancreas, we see that it increases our ability to make insulin. By the way, it helps to protect the beta cells, which also make the insulin, and it decreases glucagon, which is what we get blood sugar from, glucagon. So we want to do that. In the stomach, it decreases gastric emptying. In the systemic system, it decreases our blood sugar, and at the liver, it increases insulin sensitivity. It decreases hepatic glucose or sugar production, and it decreases ectopic lipid accumulation. And by that I mean fats being in places we don't want them. Of course, we know fat under our skin. That's the fat that we think of. But fat can accumulate in other body organs, in particular organs like the liver. And that is why we see when we start people on these medicines, marked improvement in cholesterol levels, in triglyceride levels, in weight loss. And so I have been amazed with how this has affected my patients from a medical perspective, even more impressed with the feeling of wellness that patients come in. I have had patients come in and say, Doctor, I can't believe this has come out and that this can have such unbelievably strong effects. So, if we look at what this does in diabetes, it helps to control it in a better way. In fact, new societies, American Diabetic Association, the American College of Cardiology, they're calling to use these medicines in diabetic patients as first-line drugs because they improve cardiovascular outcomes, not even anything to do with the weight loss, but with the fact that they improve better health. But we know so many conditions occur with type 2 diabetic patients. About 75 to 80% of them have high blood pressure. About 70 to 80% of them have elevated lipids. Most of these are obese already. Many have orthopedic problems. All of these are real healthcare problems. And I really think in the long term, we're going to see that the cost of these drugs is very much offset by what happens, the positive benefits of them. Terry, you had a quote from Steve Jobs that you said before we started this podcast. Share that with our audience because I think it's impressive.
He had made a comment that if you don't eat your food like medicine, you'll be eating your medicine like food. And, I was a medical device rep for 40 years, and I would sit in the waiting rooms often to go see a physician, and I'd see patients with Ziploc bags just, with 20 or 15 or 20 prescription medications in there. And, a lot of times these patients were obese, and it just creates a lot of problems. And I think once you get your weight in check, and you get down to a healthy weight, everything just falls into line. I mean, your body is very, very forgiving and takes care of all the other things.
So let me just give you some specifics. We've mentioned statistics in a general sense, but we know that people who have hyperglycemia, elevated blood sugars, have 11 to 16% increase in cardiovascular events for every 1% increase in their hemoglobin A1C or their long-term blood sugar levels. Dyslipidemia, the abnormal blood fats. We know that type diabetics have dyslipidemia in general, and the lipid abnormalities affect 60 to 70% of these, and these influence the development of blockages, what we call atheroma or atherosclerotic disease. In insulin resistance alone, even before we start to see very, very high blood sugars, we know that there's greatly increased risk of these patients going on to have heart attacks and other problems. And something we don't speak about very much, but there are increased inflammatory markers in the body. And so these things are very important because these contribute to the high blood pressure, to the diabetes, to the orthopedic problems in addition to just the weight and the wear and tear on our joints. So they're real important things. We also have things we don't speak about much. We have endothelial dysfunction. Endothelium is the part of our blood vessels that touches the blood that's going through it. And this can cause spasm and cardiovascular events and heart attacks and stroke and things like that. We know that these patients can become hypercoagulable. By that I mean their blood's more likely to clot. And typically the final event causing a stroke or causing a heart attack or causing someone to lose a leg is that they have a clot. We increase reactive oxygen species. We all hear people taking antioxidants. And the reason we do that is these antioxidants cause abnormalities in our blood vessels. Again, we decrease this. And then finally, vascular calcification. Our vessels should have the consistency of rubber bands, but sometimes they develop consistency of a lead pipe, and they're just simply not flexible. And this is important. So there's inflammation. There are all these other things going on. These create a prothrombotic state, and this is really life and death issues. So what do we see? Well, if we look at the problem that we're facing with obesity and diabetes, life expectancy on the average was reduced about 19 years in adults with type 2 diabetes. It was a leading cause of atherosclerotic cardiovascular disease, was a leading cause of death and disability in patients who have diabetes. People with diabetes have a 2 to 4 times higher risk of myocardial infarction or stroke than those who don't have it, and 3 times higher risk of heart failure and much higher risk of losing legs and developing kidney failure and needing to be on dialysis. So these are not minor problems. These are true health problems. And the sooner we address these, the younger age we address these, the better we address these, the better patients do it. I know of very few people who are morbidly overweight who want to stay that way. I think most people would like to lose that weight, but they don't have a path to get there. And they try. They feel bad as they try,
Guilt.
and they don't get there. The class of drugs that we call GLP-1 agonists are a great class of drugs. They are impacting likelihood of having heart attacks and strokes, and we can see that this drug has been shown to lessen, this class of drugs, to lessen the likelihood of heart attacks and stroke. And so I think make these drugs very important. There's another class of diabetic drugs that we'll speak of that are also showing weight loss, that also have their other effects. And in fact, this other class of drugs has been called by perhaps one of the best known cardiologists in the world, Dr. Brunwald, as important as the development of statins. And we all know statins changed cardiovascular care. But the best thing I can say about this is that we now have hope when we're treating diabetic patients. And so many diabetic patients, I see these people, I hold their hands, I talk to them, and so many patients that come in with obesity have lost hope. They said, Doc, I've tried everything, it's not going to get better. And to be able to help someone get over this and to lessen their risk is for me one of the really rewarding things that I've done. And I recognize how big a problem this is and how much it has affected people. We can do a better job, simply put, with these medicines. GLP-1 agonists are one of the things that help us treat this.
100%. I'm living proof. I'm on the program right now. Thank you, Dr. Walker. Thank you. Thank you for joining us here at Cardiovascular Matters. We've just completed a couple presentations on obesity and some of the great new drugs and treatments that are incredibly impactful. I'm living proof. I'm in a plan right now, and I was motivated by Dr. Walker to do so, and it's changing my life. So if you're a patient out there and you've tried everything else and you just can't get the weight off, look into this. I mean, he's easy to reach at www.cardio.com. Everybody have a great week, and thanks for listening.
Thanks for listening, and please subscribe, like, and share this podcast with your friends and family. Join us next week for new topics and answers with Dr. Craig Walker and Terry Roberts on Cardiovascular Matters.